Hello everyone. So today we are going to talk an important topic, that is dyspepsia. Dyspepsia. Okay. What what does mean dyspepsia? Okay. So basically, in the stomach, the stomach secretes number of digestive enzymes, digestive juices to digest the food. Okay. So we have three things related gastrointestinal tract. One is digestion, absorption, and defecation. So if the problem occurs in digestion due to the stomach, it is called dyspepsia. Okay. So it is disturbance of digestion. What is dyspepsia means? Disturbance of digestion. Okay. So disturbance of digestion is known as dyspepsia. So nowadays it is very common that most of the people have dyspepsia. Okay. So we have to treat this with the help of medicine, with the help of simple steps, can treat all these problems. For different types of dyspepsias. Okay. One is organic disease. Okay. Okay. And is any type of organ disease. One is organ disease. Organ is involved. Directly, stomach is involved. Stomach having any uh, neoplasm, any non-cancerous growth, or we have ulcer, we have peptic ulcer, or carcinoma, means the stomach itself involved for the disturbance of digestion. Another is, second one is reflex, reflex dyspepsia. What does reflex dyspepsia? It is due to the other related diseases. Like we have cholecystitis, inflammation of gallbladder, pancreatitis, or any infection in the stomach or in the intestine, like worms, like amoebiasis, fungal infection. So this is called reflex dyspepsia. And third one is systematic diseases. Due to the systematic disease, the patient have, okay, the patient have dyspepsia. What are the systematic diseases? Like cardiac problem, pulmonary issues, anemia, or hyperthyroidism. Okay. These are the one of the reasons of systematic diseases. So one is organ diseases, means stomach itself involved, and second one is we have a reflex dyspepsia, in that other organs are involved, like gallbladder, pancreas, okay, or infection, or are involved. Next is systematic diseases, in that other organs are involved, like heart, like pulmonary, lungs, like anemia. This will cause dyspepsia. Next, another type of dyspepsia, that is functional disorder. What is functional disorder? Functional disorder means your food eating habits, or you have any type of particular habits. Due to that habits, your stomach is not doing digestion properly. This is functional disorder, like taking spicy food, which cause the harm of inner lining, epithelial lining of stomach, and taking dis, uh, de- uh, depression, anxiety, which will also cause dyspepsia. and lack of sleep. Okay, always sitting, not drinking water properly. Okay, and eating food, contaminated food, or taking night food, refrigerated food, or cold food, raw food. Okay, and delay of defecation, stool disorder, constipation having. So all these are come under functional disorder. Okay, lack of sleep, taking, smoking, alcohol drinking, okay, and smoking, and you have eating good carb. Due to these things, you can have dyspepsia. Yeah. Okay. So these are the types of, or this is the reason behind the dyspepsia, or you can tell. It may be sometimes it is acute dyspepsia or chronic dyspepsia. Acute means suddenly it will start. Okay, in acute dyspepsia, what will happen? You will have sudden pain in the abdomen or epigastric region, or nausea, vomiting sensation, or sometimes fever, okay, or tightness in the abdomen, which is suddenly it started. It doesn't have from the longer time. Suddenly you eat more spicy food, which is not bearable by your stomach. You ate any improper diet, which is not digested by the stomach. You take long period refrigerated food, that will cause dyspepsia. So there are number of reasons which cause dyspepsia. That is acute dyspepsia. In chronic means it have from longer duration. Chronic, you have from the longer duration. Okay, it may be due to the bad habits, and you have any organ issues. Okay, any reflex dyspepsia, and other organ issues, or functional disorders, systematic disorder, anything else. The chronic, it will continue from the longer term, more than 3 months. Okay. So sometimes what will happen in chronic, we have to understand the chronic dyspepsia. The chronic dyspepsia, one is due to the weakness of stomach. Okay. And second, due to the any neurological or anxiety, depression, nervous issues, which leads to dyspepsia. Neurological, neuro issues. Okay. Chronic, it may be due to the weakness of stomach or neuro issues. Okay, so you have to ask the patient about any psychiatric issues, anxiety, depression, okay, anger, okay, nervous debility. All these things you have to, any issues, family issues, personal issues, or any job issues, anything you have to ask about to know the anxiety, to know the depression level of the patient. Okay, so this is very important. So what are the clinical features? What are the things the patient will tell you? Very, very important. This is the thing you have to remember. Clinical features. Okay. Clinical features. What are the clinical features? First thing, patient will tell you that always after eating food, I have discomfort and fullness with epigastric pain. It is very, very important. First, discomfort, and you have fullness and pain in epigastric region. Okay, this is the main clinical symptom the patient will come and tell you, sir, I have very discomfort and very fullness and very pain in epigastric region. Okay. After eating food, without eating food, I am okay. I am okay, no tension. I don't have any issues. After eating food, this will start and I will feel very bad. Next, simple things you have to remember, very, very important while asking the patient. Okay, next, we have second thing is that the patient have loss of appetite. Appetite, there is no appetite or less appetite. Okay, there are less appetite or no appetite. This is very important. Second thing is that, and the patient have burning sensation in the epigastric region. Okay, epigastric region, heartburn is there, and acidity issues. Okay, and we have next fifth one is patient have flatulence gases. And the sixth one is very important, nausea, sometimes, not always, sometimes nausea. Next, seventh one is clinical features. These are the patient will tell you, okay, sometimes water in the mouth, acidic reflex, acid reflex, and sometimes you have constipation. So these are the clinical symptoms. The patient will come with this condition, discomfort and fullness and pain in epigastric region, loss of appetite, heartburn, acidity, flatulence, nausea, acid reflux, constipation. All this very, very important. Okay. These are the symptoms of dyspepsia. But sometimes you need to evaluate all the abdominal issues of the patient. If it is chronic, go through the abdominal radiology. You need to do endoscopy. Sometimes it will be ulcer in the stomach, peptic ulcer. Okay, so you have to evaluate. And sometimes you need to do USG abdomen. Sometimes you have other organ related issues like cholecystitis, pancreatitis, okay, fatty liver issues. Okay. These are the things we have to remember. So endoscopy sometimes needed if we have seriousness after giving the treatment also. If it is not recovered, it means there is an issue in the abdomen. You have to take the camera and they will do it and you have to we get the report and we treat the patient. Okay. So these are the clinical symptoms. This is the radiological things. We need to evaluate the patient. If any blood is there, vomiting, blood vomiting is there. Okay, sometimes. So we need to evaluate further. We have to check the blood, okay, blood level also. What are the basic treatment? If it is not severe condition, moderate or mild condition, how to treat the dyspepsia? Okay, let's talk about the treatment. In that, we will treat all these things: discomfort, loss of appetite, heartburn, acidity, flatulence, nausea, acid reflux, constipation, everything. If we have other flatulence also have a number of reasons. We will talk in particular in next class after that. Okay. So what are the remedies we have to take for dyspepsia? Because it is related to stomach mostly. If it is stomach related, we have the remedies mostly S1, okay, S10, these are the C10, C15, and C15. If it is related to other systematic disorders like The cholecystitis is the pancreatitis is then you need to add S2 also sometimes. Sometimes you have to S5 also. Okay. C2 and C5 also. Okay. If due to the infection, you need to take Verban also or sometimes Voltaren. Structural things also noted. Sometimes you will take Venban also. And we have L1 also. So according to the condition, we need to select from the remedies. So basic dyspepsia treatment, what we are going to give is S10, L1, WE, next C15, WR1, WR1, YE, and third one is S1, and we have S1, WE, and fourth one is we have S10, C10, S loss, and according to the condition, you can give in D if the chronic D4 or D5 if the acute D6. This is the initial basic prescription for dyspepsia. If it is not cured, and WE also for application in the abdomen, WE apply. Application is in D4 only. Okay. Apply the D4 in the epigastric, all the whole abdomen. You have the 9 parts in the abdomen. You have to apply. So this is about dyspepsia. I hope you understand about dyspepsia, what are the causes behind that, and clinical features, and what type of scans required. If it is chronic, you need to do endoscopy, ultrasonography. Already the patient will have the reports. You can see, check them, and note down the reason behind that and treat the reason. You will definitely get the results. What this is all about. If anyone have any doubts, kindly ask.